Wait times for surgeries and medical procedures are going in the wrong direction. The strain on the healthcare system is only getting worse, and now patients are waiting longer than they were before the pandemic for things like hip and knee replacements. CTV's Katelyn Wilson joins us with more on this. Katelyn?
Graham, this has been bad for years and much worse during the pandemic. These procedures like hips and knees can badly impact people's lives. It was supposed to get better by now, but it has not.
For Anyek Pichet, getting through the day-to-day isn't always easy.
I'd say in 1 week, I'm in pain 6 out of 7 days.
She's been waiting for foot surgery now for more than 2 years.
They called me early 2024 in February and told me that they were looking at potentially at the earliest booking for September, October of this year.
And she isn't the only one. Canadians are now waiting longer for hip and knee replacements, cancer surgeries, and other priority procedures than before the pandemic, according to a report by the Canadian Institute for Health Information.
I would say we've made modest gains in the past year, but nothing that's significant or that's meeting anywhere close to the promise that we made Canadians.
The latest data shows 66% of hip replacement patients had surgery within the 26-week benchmark, down from 75% in 2019. And 59% of people received knee replacement surgery in the expected time, compared to 70% pre-pandemic. Although Ontario is faring slightly better.
The percentage of patients who are getting their hip replacement surgery, knee replacement, and cataract surgeries within the recommended time frame is actually a higher proportion of patients in Ontario than the Canadian average.
Here in the capital, the Ottawa Hospital has partnered with a group of orthopedic surgeons to perform hip and knee replacements along with shoulder surgeries on weekends, saying it's led to a 20% increase in surgical productivity, telling CTV News in a statement it's performed 619 procedures in the past year covered by OHIP.
The message we want to convey here is there's a big problem. There's people waiting in pain, but there's also potential solutions.
Pointing to same-day surgeries, recruiting staff, including physicians' assistants, and increasing capacity within hospitals, so people like Pichet can stop waiting and start living their lives pain-free.
And Shui says the numbers are trending in the right direction, with more surgeries performed last year, but still falling short compared to pre-pandemic. Graham?
All right, CTV's Katelyn Wilson live for us. Thanks.